Hello students, you are aware of the concept of counseling, types of counseling, and now we will be discussing about the different areas or fields where we can apply counseling principles and the techniques. So let us today discuss about areas of counseling. What are the different areas, different arenas where we can put into the use the principles and techniques of different counseling therapies. So to start with, we can say the most important area where we can use counseling is child counseling. I think you agree with me if I say counseling adults is much easier than counseling children. It is not so easy to deal with the children who has come for the counseling. If you just try to sit and talk to them like an adult, naturally they would not open up their mouth and they may withdraw from you or try to leave the counseling room. So the methods which we have to use in counseling the children should be different from the methods that we use in dealing with the adults. Before identifying what techniques we can use in the child counseling, let us see what are the reasons for which generally children come for the counseling. If you observe, most of the time parents complain about academic problems or difficulties, including lack of concentration or not able to remember, that is memory problems, or difficulty in studying or reading, so related to the learning disabilities, some of this sort. So apart from these academic difficulties, there could be some adjustment problems which may occur because of certain traumatic experiences in the life of the child. So that could be a bereavement and loss of a loved one in the child's life. Many children who were experiencing these kind of the situations when they were at a very younger age may have difficulty in adjusting to the reality or into the other aspects of the life. Not only the loss of a loved one, but sometimes even if a pet dies, it takes time for them to adjust to that. And there are many people who can go into the depression, many children who can go into the depression because of the death of the pet. If you leave these things aside, most often like children will be having some difficulty in the adjustment when their parents split up, that is either because of the divorce or they get separated, or if a favorite teacher or a friend has moved away from them due to some reason like a transfer. These children become very vulnerable to adapt to these situations. Of course, this does not happen with all children. Most of the children have that resilience attitude where they try to come back to the normalcy. But when they cannot cope with these situations, only then the problem arises as to how to make them accommodate to these situations. Naturally, when they are not able to adjust, that will have an impact on their academic performances and also in their relationship with the peers or with the family members. During this stage, either the school authorities or the family members would try to bring the child to the counseling. So here we have to make an effort to help them deal with their life stressors. Another important reason why generally children come for the counseling is because of the trauma. Some children may experience traumatic situations or experiences like death, violence, abuse or neglect. These situations will also create an impairment in their functioning in the total life, whether it could be at the school level or at the family level or when they are in the playground. Other reasons why generally children come for the counseling are when they have a struggling time, as they have to take care of their sick or disabled parents or siblings, when they are a deprived child in the family and when they are completely neglected and lacking the attention of the family members, or when they feel they don't fit into the school system, they feel they are not worthy to continue in the school, or when they are being bullied. Sometimes when they are bullying someone, but when they know that it is wrong, but still they do not know how to stop it. Some children may feel very angry and feel that the whole world is against them, it is their enemy, and they don't know how to fight it. And they feel that they are misfit in the world. Another reason is because of the feelings of inferiority or low self-esteem, and as a result they try to withdraw, they do not try to engage in any of the constructive behaviors. So for these reasons, children may come for the counseling. So when the children come with these problems, if you try to go on having a normal conversation like how you would have with an adult, children will become bored. So the strategies which we use in dealing with these children to open up and then make them deal with the situation, cope with the situation, the strategy should be definitely different from what we use with the adults. So there should be a different media, different techniques which can really make them use those techniques in order to ventilate their grievances. For instance, we can engage the child in play or use a different media like miniature animals, clay, or various forms of art. Or we can involve the child in a storytelling or take them on an imaginary journey. As a consequence of combining various techniques along with the verbal counseling skills, we can provide an opportunity for the child to join the counselor in a therapeutic process. And counselors should also provide a constructive environment that would facilitate a therapeutic change for the child. When we are providing counseling for the child, there are 4 goals. Level 1 goals are fundamental goals which are necessary to bring about the change in the client. Level 2 goals are set by the parents. What is that they are expecting to achieve out of this counseling process? Level 3 goals are set by the counselor, and level 4 goals are set by the child. All these goals are important, but depending upon the situation, one goal may become predominant than the other. Though there are specific procedures and a specific agenda which has to be followed by the counselor in counseling the child, sometimes the counselor need not be rigid to follow that. We should always give importance to the child's needs rather than the fixed agenda. Only then we can expect an active participation from the child's side, and that would help us to proceed further in the therapeutic process. Next area is adolescent counseling. This is also very vital, very important in the present day situations. You know what is the period of adolescence, how different it is from the childhood and also from the adulthood. It is a period of transition. Naturally, we expect a lot from this adolescent because the adolescent is neither a child nor an adult. So he has his own confusion of handling his situations. In fact, this is a period where an individual moves from independency to dependency to autonomy and also maturity. Until the period of adolescence, family was the core part of the adolescent, that is core part of the child. Once they enter into the adolescence, peer group, the society and other outside environments will become more significant to the adolescent, and there comes the problem from all these environments which may be posing different challenges for the adolescents. Adolescence period itself produces many challenges, many pressures at different levels like physiological, biological, psychological and social. When an adolescent is unable to confront these challenges and pressures posed at the internal level and also the external level, there comes the need for the counseling for an adolescent. When we speak about the environment, there are different types of environment which also pressurize the adolescent to cope with these situations. These pressures may arise from family environment, education environment, work environment, changing relationships, exposure to sexuality issues, socio-economic pressures. Apart from these pressures, sometimes there are also hazards which may inhibit the functioning of the adolescent to the optimum level. These hazards could be because of the influence of parents and the peers, peer groups and gangs. or it could be because of the unhealthy habits they have developed, like smoking, sniffing, alcohol and other usage of the substance abuse and other usage of the substance, sexual behavior, risk taking and also suicidal behaviors and weight control. So these hazards may also inhibit the functioning of the adolescents and which may require some kind of a support at the professional level. So when the adolescent comes for the counseling, the counselor tries to identify from where it has developed, how it has developed, when he has developed, and based upon that the adolescent will be taught new ways of coping with these situations, and this will help him to go smoothly on the developmental journey. Next area is career counseling. Career counseling is of equal significant field, especially when a child enters from the high school to the intermediate level or from the intermediate to the degree level. Career counseling is very vital. We can define career counseling as a process of helping the children in the development of a life career with a focus on definition of the worker role and how that role interacts with other life roles. In fact, we need not confine this to the student level itself. Sometimes career counseling is also required at the middle age or at the adulthood when an individual tries to shift over from the existing job to the other. So the decision making process of the counselor is very important in this career counseling. The first step that is involved is defining the problem of the client, which leads to recognizing a decision. Then comes the establishment of the action plan, where the counselor along with the client tries to refine the decision. Then the clarity of the values is essential before we show which career is appropriate to the client. This occurs through examining, that is self-observation and worldview generalizations regarding various jobs. Identifying alternatives, that is generating alternatives from the existing assumptions or views. Then discovering probable outcomes by gathering information. Then eliminating alternatives, which is possible by assessing the information. Using all these steps, then the counselor set into the action plan where he tries to execute or implement whatever the course of action has been taken by the counselor and the client. In fact, Mitchell and Krumbolz identified certain intervention strategies. The two most important intervention strategies which are essential in career counseling are developmental and preventive. For example, related to careers education, use of job clubs, occupational information resources and simulations like work experience. Another intervention can be at the targeted and remedial level, that is career practitioners becoming proficient in using cognitive restructuring. This implies reframing the perspective of the client, that is when the client lacks certain resources or potentials but still insists that he prefers a better job, similar job, naturally we can use this kind of a intervention at this particular level. For example, a client who is extremely nervous about attending a particular interview can make him reframe his mind that he is only trying to experiment upon how he can please his prospective employers. We are inculcating a positive self-talk. Career practitioners also use number of behavioral therapy techniques like role playing or trying new behaviors, desensitization when dealing with interviews, and paradoxical intention. That is, a client is helped to engage in the types of behavior that actually created a problem. That is, we are asking the client to engage in those behaviors which he is avoiding all these years. Another area of counseling is marital counseling. It is natural tendency among the human beings that when there are more than one person, conflicts are bound to rise in some situation or the other, and this is so common among the marital couples. But as long as these conflicts or arguments are not hindering the smooth functioning of the marriage, there is no need for any kind of a marital therapy. But when this kind of a cooperation or a compromise fails, and continuously if the couples are confronted with serious arguments and conflicts, then the need arises for the marital therapy. In marriage counseling, the couples are asked to explore the ways where they are getting stuck up in the conflict, why do they are stuck up in the conflicts, and how to break those negative cycles. So this marital therapy enables the couple to work effectively in identifying the situations which is causing them the conflict or leading to the differences, and what strategies they are using which are creating a negative impact on the partners. Once it is identified, they are taught mutually acceptable problem solving strategies in the marital therapy. Some of the marital problems with which the couples generally come for the counseling are inability to compromise because of the ego problems, sexual difficulties, financial crisis, child rearing conflicts, and also extended family issues, that is relationship problems with the in-laws and others. When a couple come for the marital counseling, there are various marital therapy techniques or approaches which are used. Some of them briefly we can see. One is emotionally focused marital therapy. In this therapy, couples are asked to identify and break their destructive emotional cycles, such as when one person criticizes, the other withdraws. So this particular approach helps the couple to build trust on each other. Another important approach is insight-oriented marital therapy. This is a combination of behavioral therapy and teaching couples how to understand their power struggles, defense mechanisms that they are using, and other negative behaviors. Once we give an insight why actually the problem is cropping up, probably they may find out the actual cause rather than the superficial reasons for which they are fighting. Integrative behavioral couples therapy is another approach which we use as a part of marital counseling. This particular therapy or approach teaches couple to make arguments less hurtful to the other partner so that they can accept their difference. Sometimes the words which we use, that creates more impact rather than pointing out what is that they are doing or where the problem lies. So instead of using abusive language, if we make the partner understand where the actual situation is, why they get offended or where the problem is, probably that may help them to focus on the actual problem rather than being sensitive to the words used by the other partner. The therapy is, this particular therapy, that is integrative behavioral therapy, focuses on the idea that what is important is how a couple fights, not whether they fight or not. So at what intensity, what sort of abusive language that is involved, that is damaging the relationship rather than a mere fight. The behavioral marital therapy approach is another method that can be used in dealing with the couples. Here we try to teach the couples how to be nice to each other, how to communicate better with one another, and how to handle conflict in an effective way. Apart from this, we can also have relationship counseling. When we say relationship counseling, it is not between the couples, it could be between the siblings or it could be between friends, where so far the relationship is continuing but now they feel it is withering away due to their differences. So we can identify in the relationship counseling what are the situations that are building the gaps between the members in their relationship and how to break those gaps, that is how to bridge these gaps. Next area of counseling is geriatric counseling. You are aware that in today's population, world population, more than the youth, the percentage of the aged people is increasing. Naturally, they will be dealing with various issues at the physiological level, at the psychological level, cognitive level, and at the social level. All these deficiencies may be creating an impact as to how to cope with their present situations. But the major problem in providing geriatric counseling is assessment itself. How to assess the geriatric patient, whether it is purely the medical problem or whether there is any psychological problem. So that needs to be taken care if we can have a complete health checklist given by their family doctor. Sometimes they may feel isolated because of their problems, like physical problems like hearing problem or vision problem or any other kind of the biological related things like change in the BP or respiratory rate, all these aspects. Or it could be the financial problem as they are left with no money, or it could be a social aspect as they are feeling inability to move or meet the people and so socially withdrawn, not because of lack of interest but it could be because of lack of transport. And they may also be experiencing emptiness syndrome as children were busy with their own lives, leaving them. So all these things will have an impact on their feelings of loneliness, depression. So here first we have to take an assessment of them about their medical checkup and also at the psychological checkup, and then we can provide the counseling based upon what is the actual reason with which they are suffering. So here we can conduct some medication reviews about their diet, whether they are following their medical regime related to their medication for BP, sugar or any other ailments, whether they are able to adhere to the diet that is prescribed by the doctor for their better physical and mental health. And once that is taken, we have to teach them certain strategies as to how to make them learn to adhere to the certain routine situations like taking diet, taking medication, and also as to how they can use their leisure time within their constraints. So for this, sometimes we require community support, or if there is any support from the family support. So ultimately through the process of counseling we can able to improve their well-being and also their adherence to their compliance to their medication and also to the diet. We can also bring about some awareness as to how to lead this kind of an old age, showing certain role models of their own age. So this is all about the geriatric counseling. Next area is family counseling. It is often the behavior of a single family member that brings a total group into the family counseling. But if you observe, most of the time when an individual comes with a counseling, especially if it is a child counseling, we try to see that the child has a problem. But in most of the cases it is not the child who is having a problem. He is only showing the symptom of a problem, and the problem is lying in the family itself. So once we talk to an individual client, whether it is a child or an adolescent, then the counselor identifies that it is the family structure which is creating an impact, or family dynamics which is creating an impact on the behavior of the child or an adolescent or any other adult individual. Generally, like when we involve the family, it is a nuclear family with husband, wife and the children, and in very rare cases it would be an extended family. So the goal of the family counseling is to help the family members communicate in an effective way with each other and also teach them how to resolve the conflicts in a better way within the family unit. Generally it is observed that even if one family member has a serious pathology, all members can benefit from counseling in order to learn how to best support this individual. And as caregivers or support providers, they also be given some counseling as to how to handle themselves. Then what is the process of family counseling? When the counselor is providing the family counseling, he gives attention to how the members are interacting. He not only observes the content of the counseling or the interaction, but he also tries to identify the style of the interaction and what conflict resolution methods that they are using as a family unit. In some cases, the counselor may observe that a single individual is the focus of the conflict. Everyone is targeting that individual. In others, one or two members may be involved and the rest of them are completely withdrawn from what is happening in the family. So once the counselor identifies all these dynamics, then he can provide a particular counseling program to the different people on their communication patterns, on their interaction styles, and also about the resolution of conflicts. Another area of counseling is group counseling. Suppose if I ask you, like, individual counseling is easy or group counseling is easy, or whether people prefer individual counseling or group counseling, it is very difficult to answer, because individual counseling benefits in its own way, group counseling has its own benefits. And which process is easier, it is very difficult to say. Dealing with an individual is not an easy task. Dealing with a group who has common problems or similar problems is also not an easy task. However, group counseling is very popular for a number of reasons. Because one is, it is less expensive compared to the individual counseling, and it also requires fewer sessions compared to the individual counseling. And in group counseling, there may be more than one facilitator or a counselor, and sometimes, depending upon for which reason the counseling is conducted, there may be a panel of psychologists, psychiatrists, and social workers. So the burden is not on one single counselor. Most of the time, the counselor will be taking a passive role, but tries to focus or engage the group members more often and see that they are taking an active part. Group counseling has its own advantages. Any individual who doesn't has the courage or willingness or motivation to discuss his own personal problems at an individual level may be benefited by being a participant in the group. Even if he doesn't share, by listening to the others' similar problems, he can get an insight and also the courage to deal with the situations, and also an awareness that what techniques can be used and how others are using it. Or sometimes by looking at the others, he can also be motivated and take an active part in the group counseling, which may not be possible in the one-to-one counseling. Another important area of counseling is grief counseling. Loss is extremely difficult for almost everyone, especially the loss of a parent, spouse, or a child. And this is more observable, most common in the present day's isolated society, because people lack the effective coping mechanisms to handle these situations, and there is no one to share with them how they have to come out of this kind of a grief. So sometimes the grief counseling at the professional level is required to recoup with the situation. But most often, many cultures have the inbuilt mechanisms for managing this kind of a misery. These systems allow the individual to mourn a loss, integrate the loss into the life, accept the loss, and then move forward. All this happens within a brief period. But when this is not possible, when this is not happening with any individual, or when the cultural system is not so effective, or social support system is not effective, naturally the individual will be caught up in this cycle of grief. So grief counseling can help the individual break that cycle and then move on with his life. Grief counseling can be at various forms. It can be at one-to-one level, or it can also be at the group level. If it is an individual problem, generally it is taken at the individual level, but if it is a family problem, naturally a group counseling will facilitate them to handle the situation in a more effective way. Next area of counseling is post-traumatic stress counseling, which is known as PTSD. Any traumatic event in the person's life or integrate sense of self can cause a post-traumatic stress reaction. This post-traumatic stress reactions can range from mild to major. Some of these events we can look forward. Some of these events to which we can look is personal injury. Personal injury can cause post-traumatic stressful reactions like stabbing, beating, assault, domestic violence, rape, sexual violence, torture and kidnapping. So all these experiences may create a traumatic reaction experience and also a stressful reaction. Another event could be accidents. It could be road traffic, because of the road traffic, or train or plane, or it could be accident at workplace, or collapse of the building, and also bomb damage, which are recently like increasing most often, which we are seeing in the rampant. Then another aspect that may cause the post-traumatic stress is witnessing natural disasters like hurricanes, flooding, earthquakes. Life-threatening situations like childbirth, surgery, severe illness or continuous bullying can also cause the traumatic experiences. However, all these symptoms began once the incident occurs. Another area of counseling is counseling for depression. Depression is highly prevalent not only in geriatric patients or in the adults, but also in adolescents and also in the children. So whether a person is experiencing the feelings of sadness or depression depends upon the severity of the symptoms and also on the duration of the symptoms that are present. Depression is also diagnosed based upon how the mood of the individual is affected, showing the impact on his functioning, both at the psychological, behavioral, cognitive level and also at the physiological level. So some of the symptoms a client can experience when he is with depression is lack of joy, loss of feelings, feeling of hopelessness, social withdrawal, lowered or heightened appetite, sleeping difficulties, pessimistic or negative thoughts and lowered self-esteem. In severe cases of depression, psychotic symptoms like hallucinations and delusions are also present. In order to treat these people with depression, cognitive behavior therapy is proved to be widely useful in order to challenge their negative beliefs and incorporate or replace the positive beliefs about themselves using the affirmation statements and other techniques. Sometimes we can also use the relaxation methods and problem solving skills and making them engage in the present activities by providing which may create the positive distraction and making them focus on the task oriented behaviors. Nowadays we are seeing different techniques like mindfulness meditation or mindfulness based cognitive therapy, which were proved to be very effective. Another area of counseling is counseling for sexual abuse and rape. As we are witnessing number of cases who are affected with this kind of a sexual abuse or rape, naturally counseling sessions for these people, especially the women who have witnessed this or experienced this, require those kind of facilities, because they are psychologically affected to such an extent. They may show an array of emotions like being frightened, experiencing guilty, feeling powerless, showing bouts of anger, ashamed, depressed, feeling numb and also lack self-confidence. And sometimes they may have difficulty eating or sleeping, they have concentration problems, and in order to overcome this, naturally the counseling sessions are required to make them bring to the normalcy. Substance abuse counseling is another area where we are once again seeing more percentage of adolescents and the adults being associated with it. So here either the counselor will be providing or separate group counseling sessions are organized to make the addicted people come over these substance abuse problems and then be rehabilitated into the mainstream. Last but not the least, another important area of counseling is counseling for HIV or AIDS. When we are speaking about counseling for HIV or AIDS, it has two aims. One is to prevent HIV transmission and the second is to support those affected directly or indirectly by HIV. When we are providing counseling for these people, the focus is more on making them psychologically strengthened as they are showing more of the deteriorated feelings about themselves, like feelings of shock, feelings of fear and anxiety, depression, anger and also guilt. So when we are providing counseling, it is not only focusing on their present feelings but also helping them to cope with the present situation. And secondly, the counseling is also used for the prevention of HIV by focusing on the lifestyles of the individual who are at risk, by making them aware how their life is at risk, their lifestyle is at risk, their poor habits may create a risk factor for the cultivation of HIV, and other factors are also taken into consideration. So we can say the counseling for HIV aims at prevention, and if already affected, to provide them the support to deal with the present situation and see that they maintain a healthy psychological lifestyle at least for a couple of years.